You're listening to the Autism Weekly podcast. Each week we share community voices and bring light to stories that increase awareness, acceptance, equity, access, and inclusion. If you haven't already, subscribe to join the Autism Weekly family. I'm your host, Jeff Skibitsky. This week, we're joined by Dr. Brian Boyd, William C. Friday Distinguished Professor in the UNC School of Education and Director of the Frank Porter Graham Child Development Institute at UNC Chapel Hill. His research focuses on evidence-based practices, racial disparities, implicit bias, and how schools and service systems can better support autistic people and their families. Today, we're talking about the Black Empowerment and Autism Network, why representation in autism research matters, and what families, educators, and providers can do to build on more equitable systems. Dr. Boyd, welcome to the podcast.
Thank you. Glad to be here.
Well, I'm glad you're here with us. I think that these are topics that are crucial to the delivery of service, but it's also on being able to understand the impact of both the profession and on service delivery for a variety of populations. But before we go down that route, I'd love to hear the background, because most of the folks who come on and talk with us on the podcast have been driven by passion into their fields. So what sparked your interest in autism research?
Yeah, it's a good question. I think in particular, those of us who do research on the more applied clinical side of things often have some story, some connection to autism that we had, either personal family connection or sort of a clinical experience. And for me, I was a freshly graduated student from college, and I ended up working for the Teach Autism program in the state of North Carolina, which is a statewide program for autistic individuals and their caregivers. And we started, at that time, I worked with the Teach program to start a program for 2-year-olds. And this is in the late 90s when we weren't diagnosing as many 2-year-olds as we are now. And one of those 2-year-olds, in talking with his mom one day, who was a psychiatrist actually by training, she said Ben's first word was pentagon. And he could, before he even said the word, he could point out the shape of a pentagon anywhere in his environment. And I just became so fascinated by that story. What was it about, the shape pentagon that would, for it to motivate a child for it to be their first word? And so a lot of my early research was around what are called the focus interests of autistic children. How do we use focus interests to motivate their social communication, sort of skill development? But I actually then also had sort of musical interests, and I still keep in touch with Ben's dad and with Ben, and he became a jazz musician. So that early conversation with a family sparked my interest, led me to go to graduate school and study focus interests. So.
Well, I love the fact that even in the late 90s, your research and your focus was on how to be able to utilize a focus interest as a motivating or as a way to be able to develop more skills. I remember back at that same time is that in practice, sometimes it was, how do you prevent the restricted interest and how do you diminish the restricted interest instead of potentially using it as a focused interest viewpoint. But that's I applaud the fact that you were ahead of the times back in the 90s. But
Yeah, and I think some of it's related to the nature of the Teach program, what was called structured teaching, and how they approached intervention. I think to some degree, Teach was ahead of the time because they were always about how do we modify the environment to support autistic individuals, and using their focus interest is really one kind of environmental modification. So to some degree, I think having that as my starting place for autism sort of shaped the work I began to do and continue to do in the field. So.
Well, let's talk about some of that work. Just because a good way to be able to look at the service paradigm and how you're conceptualizing any sort of client case is that you have to understand ecology, you have to understand culture, you have to understand background, you have to understand race, demographics. So I'm kind of curious as what the Black Empowerment and Autism Network is, and then also is what gap in autism research made it a necessity.
Yeah, so the block, I'm actually going to tell you sort of how it came about, and that will sort of inform what it is. So I think because I've been in the field for, a number of years now, a few decades, um, a number of early career researchers, in particular Black and Brown researchers, sought advice from me around sort of how they have a successful career, sort of the things that they should think about as they're embarking on a career in autism research. And I realized that, I don't have all the answers. And there's power in community and connection. And so I decided to bring people together to have those conversations. So those of us who are doing research or thinking about research focused on marginalized communities, in particular Black and Brown communities, how do we come together to support one another in this space? And so really it's a support and networking group that we now have close to 70 members. I had no idea there were that many researchers of color, Black researchers doing research in this space. We have international members. We certainly have members from all over the country. But it's really a way to come together and talk about how do we best do this research in a way that showcases the strengths and cultural assets of communities? How do we
Mm-hmm.
best center marginalized communities in the work we are trying to do? And also, how do we support each other during these times and when we're trying to do this work? So it's really just a really support group. And but we don't just have academics. We have clinicians too. We have pediatricians. We have a variety people from a variety of disciplines and backgrounds who are part of the group.
And you mentioned that a lot of the studies are looking at also the black and brown population. I mean, it's trying to understand is how do a lot of these implications affect those that I care about. I'm a part of that community. I really want to get to a deeper understanding of. But when you look at autism research and when it was originally started, is that there was a very homogeneous population. I mean, it wasn't very diverse in who they were including into research studies. Why is that important? Why is it important to have a more diverse research set to make some of these broader decisions?
Yeah. Well, I think just diversity in research, right? It in general, it expands our knowledge base. It enhances our understanding of a particular condition that we're studying. I was having a conversation with Dan Geschwin, who's a geneticist out at UCLA. Dan has had this large study where they're studying really African and Black individuals who have children with autism, because we know that a lot of genetics research in general is built upon those with European ancestry. And he was talking about what you can learn from those with African ancestry. It may open up new genetic discoveries, understanding of new therapeutics. It all informs a broader science. And I think part of it too, what I think about is why wouldn't we want more representation in our research?
Yeah.
What's the downside of us being more inclusive in our research? And also, since autism affects communities across racial, ethnic, and socioeconomic lines, all those communities should benefit from that
Hmm.
research.
Absolutely.
So I don't see a downside to research being more inclusive and representative of the people it impacts. So I think we should be thinking from that communities of color, marginalized communities also deserve to benefit from the work we're doing.
Yeah, and I mean, just even opening up some of that research, when you look at diagnosis rates, when you look at just, I mean, some of those very basic understanding of research is that you you saw a substantial rise in minority populations as soon as the research started coming out because you might have been able to move past specific biases in diagnostic trends. You might have really started educating a population within a geographic space on, okay, so I'm going to grow the professional base here and educate on the diagnostic symptoms and to be able to get more accurate diagnoses in place. But I would imagine is that there's this constant kind of when you don't know and there aren't facts, is that you have implicit bias that's going to show up in everything that you're doing, from diagnostics to school services to healthcare. And I remember historically for especially the Black population, is that you saw far more emotional behavioral disorders instead of diagnoses that could have been, whether it's autism or ADHD or, I mean, just a variety of other things. Do you see that showing up in the same way that I'm describing?
Yeah, absolutely. As you're saying, some of this around sort of implicit or explicit biases is supported in research. We see it in sort of misdiagnoses, later diagnoses, in particular for Black children, and children who are for whom English is a second language, or come from families for whom English is a second language. We also see this. I think it's important to remember that often biases are systemic. They show up in systems of care that are supposed to support all. And so there's some access issue that is happening for these families. And we often talk about these biases or these differences or disparities showing up across sort of three categories. The first I mentioned, access. So it leads to differential access to services and support systems. So if you don't get diagnosed early enough, you don't get access to early intervention. And we see this in data across conditions, that children of color are underrepresented in the early intervention system in the US. And it's because they're often diagnosed later, so they don't get access to early intervention. The second way we see it show up is in the kinds of experiences children of color have once they're in the system.
Mm-hmm.
So one thing we know, take school systems in the US, even outside of autism. Children who live in poverty often go to schools that are more so underfunded, with less qualified teachers, with inadequate resources. So they're having vastly different experiences even though they're in a publicly funded school system like other children. And so when you add disability and intersect that with poverty, you can think about even more differences in the kinds of experiences they're getting. So there's differences in quality. And then therefore, the differences in access and the differences in experiences lead to the third category, which is differences then in outcomes.
Mm-hmm.
So, and we're beginning to see some of that. There's been this study that it's been showing up in some of the data that Black autistic children are twice as likely to have a co-occurring intellectual disability as white autistic children. And some of that is probably related to later diagnoses, inferior services that they're getting access to after their diagnosis, which is leading to disparate outcomes. And so we have to think about, but I think it's also important to remember, as I said, that biases are systemic. They don't just lie in the individual. If it was just within the individual, we could overcome it. But when there are biases in the system itself, it is harder to overcome. We have to think about how we change systems themselves to better support marginalized communities.
Well, let's talk about some of that systems change then, because it sounds like that's the root of being able to have some solutions in the future. So when you're looking at being able to modify a system, is that there's got to be education going on. There's got to be something on looking at the operational flow of how that's put into place. So what does the culturally responsive autism support really look like? And where does that start? Because as much as we can talk about it, you have to embed it into an implementation for it to actually have any sort of resonance. So what does that look like to you?
I think that's the place we want to get to, as you're talking about sort of how do we make systems more culturally responsive, and therefore the people who work within those systems. And I think about it in a number of different ways. I think it looks like a lot of things. I think first it looks like recognizing the strengths and assets of culturally and linguistically diverse families. It looks like tailoring supports to those families because they may not need or want the same things as other families. I think it's also recognizing the unique challenges and system level barriers that certain groups of families may face by trying to navigate a system. And so, how do you help them navigate that system? What additional supports do they need to truly effectively navigate and interact with that system? It's also about having a more diverse workforce, a
Mhm.
workforce that may understand the experiences and unique challenges that those families may be facing. I think the other thing it's about about engaging in true shared decision making and trying to, the extent possible, not have differences in power. The
Mhm.
power dynamics are often what keep marginalized families from being able to access the same level of services and support. And all of this, I think when you're talking about culturally responsive systems of care, start with just some basic cultural humility,
Yeah.
recognizing that you may not have all the knowledge about this culturally different group. And so recognizing the biases and assumptions you may carry about that group and sort of engaging in some self-reflection throughout the process as you're interacting with that family on their journey. Are you checking your biases? Are you aware of your biases? Do you have that cultural awareness needed to really support that family? I think we can build culturally responsive systems of care, but they take work on our part.
Yeah.
We as a professional have to do the job of making the system more culturally responsive. And so it's not about the family. It's not on the family. It's our job to better support, to find ways to better support that family.
Yeah, I mean, and I think you hit on a variety of those things, whether that is making sure that there is a broader clinician base that's representing a broader population, which takes time. I mean, it means that people have to be moving into these professional clinical roles, degrees, and that we need to be investing in that because it makes us all better. And then it's also looking at those pieces that you're talking about where, there is bias. It's as much as we can educate and put that as far as the education curriculum is that there's always going to be a level of bias and that could be from anybody just because of experiences or because of lack of understanding or education around an issue that creates a little bit of ignorance on concepts where we're trying to make assumptions. Um, when I think about some of the families, especially kind of those that have language barriers or that present differently than the group that they're trying to be able to discuss material with, is that there's dismissive sort of responses sometimes, whether that's in a school or a physician's office, about concerns, about potential symptoms, about other areas where they try and make an assumption or a rationalization of why something's occurring without looking through a total lens. How do families how can they advocate for themselves in a system like this, whether it's in an IEP or in a doctor's office, to make sure that they're heard, that their concerns are real, and that somebody is attending to them?
Yeah. I often say there's strength in numbers. I think, it's important for families to remember they don't have to go through it alone, and they're probably not the only family facing that particular challenge within that system. So how do you connect with community organizations or other local agencies that have experience with advocacy and can
Mhm.
help support the family in navigating that particular system? So, I think
You're
don't feel
listening to
like you have to do it by yourself. There are others out there looking to help and support. And so finding those organizations that you can band together with and really sort of push back against what those families may be facing. I think the other thing, being a person of color myself, I think families recognize too when they are facing discrimination, when it's happening to them, and they can, and so recognizing those moments in which that is really happening and finding out ways to work with others to navigate those challenges. And look, frankly, if you need to seek legal recourse, do that too.
Mhm.
Push back against those systems when they aren't providing the service you know you are deserving of, your family and child are deserving of.
Yeah, and I mean, when you're talking about those services, it's the access and then the delivery. But when we're talking about the access, is that there's also resource issues that are inherent in the system. And you talked about systems creating some of these discrepancies and in who's able to access the appropriate level of care and to make sure that it's measurable across populations. Um, how how stressed is the system of care in certain areas, especially say it's more urban, where you might have more dense of a minority population? Is the stress on the healthcare system and creating some of these issues as well?
Oh,
You're listening to.
sure. I mean, a number of the systems our families have to navigate are underfunded in different ways, whether it's the Medicaid or educational funding. They're being challenged by, shortage of funding and then a shortage of staff and qualified personnel to work within those systems. And I think whenever systems are stressed, that's when it leads to shortcuts that aren't always helpful for people trying to interact or navigate that system. It leads to cookie cutter approaches to treatment and supports, trying to give everyone the same thing when that doesn't work for any family, regardless of their racial or ethnic background, socioeconomic background. Most of us need sort of individualized and tailored support to some degree, but a number of our systems, I think right now in particular, are under stress. And I think people are trying to think about cost savings and all those things. And not those things aren't things we have to think about, in particular in the moment we're in,
Yeah.
but it's how do you think about those things while also still trying to maintain some kind of quality? And I think part of what we can do is still thinking about how do we train and diversify our workforce? How do we even work in partnership with others who may have connections to those communities to make sure the quality of care is still good and valuable, all while we're trying to maintain cost savings? I think there are other ways we can ensure that we don't lose quality and connection to communities while also trying to think about things like costs that are impacting systems.
So what is the role for a researcher? So a lot of this stuff goes undiscovered. And because there's not a lot of emphasis into finding and researching specific communities, is that oftentimes is that it's kind of like, well, I'm blinded to the issue, so I don't need to take care of it. So how can researchers involve the community or even unilaterally start to kind of make some of these decisions to be able to draw a spotlight on some of the issues that need to be addressed?
Yeah, my first thing would say is don't do it if you aren't really interested in it, because communities can tell when people are inauthentic.
Yes.
So do it only if you're interested in building truly
You're listening to.
truthful and lasting relationships with communities to some degree. So I think part of it, I hope I'm answering your question. You could ask it again if I'm not, is starting with asking questions that are relevant to that community. It starts with thinking about how we co-create and co-design research studies that are relevant to that community. It starts with us just not even sometimes going in and talking about our research, but going in and talking to that community about what they need. How can we best support them? And sometimes it may take, a year or two, maybe more, to build the trust you need to then talk about the research and the work you want to do. But hopefully, during those intervening years, you will have learned more about that community, and maybe and hopefully will have shaped the kind of work you want to do. But I think you approach communities with authenticity. You approach communities with sort of truly active listening that is happening, and you approach communities open to changing your ideas and your approach. So I think, but my first thing is don't do it if you aren't truly vested in that community. So let others do it who are really interested.
And does that change perspective as you've had these conversations, or as researchers in general engage the community to be able to really understand what questions need to be understood better? Has that changed the perspective of quality of life not being a one size fits all sort of thought process and measurement?
Uh, I guess I can only speak for me personally. I think research in this way has changed the way I approach research. I'm Black, but I'm not autistic. So my research that involves Black autistic people, I've had to approach it with some humility. I mean, I understand the Black experience, but I don't understand the intersectionality of being Black and autistic and what that means for your life and the experiences you're having. So, I've had to think about how I even approach this kind of research. And so I think it changes the way you even think about approaching research, the kinds of meaningful conversations you need to have to really do good work. Hopefully it humbles you a little bit.
Yeah.
And even though I have a PhD and I've been in the field for a while, it reminds me that there's a lot I still don't know, and
Hmm.
there's a lot I can learn by listening to those communities that I'm trying to interact with. So for me, it's just fundamentally changed my approach to research. But it also harkens back to the first story I told. My research has always been informed by the experiences of those I'm interacting with. In that case, it was a young boy who said pentagon. But when you're trying to do truly community partnered research, it's a whole different approach to research. And you, as a researcher, and that researcher hat has to take a back seat sometimes. And that is a humbling place to be in, but it's the right place to be in. I think if you're not humbled by the experience, you're probably not doing the work right.
Hmm. And perspective is a big piece, is that everybody's lived experience is going to guide how they're interpreting the ongoings around them and what needs to be done to be able to kind of find solutions for it. The work that you're doing at Beam, I mean, obviously, is that you all have been able to kind of discuss what community partnership really is, how to be able to tailor research so that you're actually representing those that are involved even better. But what are some of the other things that potentially Beam could be teaching the larger autism community on in their approach and how they're creating the discussions?
Yeah. I think that the big thing that Beam is about, right, is it's a support network. And I think all of us need support, but regardless of what group we in, what background we represent. And I think in particular in this moment. So I think part of the message is how do you find your support network?
Mhm.
Who's helping you right now navigate the moment we're in? How do you talk to that group that you find yourself in around the ways you can do research better? How can you better uplift and support the community that you want to reach and connect with, regardless of what that group is? You could be talking about, I want to do more research around autistic women and girls. Well, who are the autistic women and girls that you're listening to, connecting with? To help you with that research, right? So, whatever community you were trying to reach, it's really around building support systems to learn about that community, supporting each other through that space, having honest and open conversations around how you uplift and support that community, how you be a true ally, or either you're actual part of that community. So, really, it's Beam is just a place for conversation about the work and how we can do a better job of going about the work. And I should have said from the outset, Beam does involve Black autistic researchers as part of the process who have really added to the conversations that we're having.
Yeah. And that process matters, though, is that having those conversations, putting things out there for discussion, having debates, having disagreements, all of that
Yes.
is healthy for finding the appropriate path forward. So, what is one thing that, whether it's schools, researchers, or providers, could be changing in their approach that will help to create more value, more respect for autistics or autistics that are also identify culturally different than what had historically been the research base?
Mm, Good question. So one sort of piece of advice or one thing we could do, uh, I think maybe a central theme of what I've been saying is think about how you can engage in true collaboration. Like former teacher here, so how do you collaborate with families to create an IEP, an individualized education plan that truly represents both the strengths and challenges of that person, right? If you're a researcher, how do you engage in true collaborative, community connected, community partner research that reflects the values of the community? So I think in all of this is how do we engage in true collaboration with the people and the groups we're trying to reach a little bit. So I think it just shifts it a little bit. Research is quite hierarchical, and here we're trying to make it a little more equal and truly more collaborative in nature. And so I think that's my one thing I hope we're changing is we're thinking more about true collaboration in some of the work we're doing.
And collaboration, similar to what we just talked about with the way that Beam operates and being able to create conversation, dialogue, questions, collaboration should be doing the exact same thing and
Absolutely.
respecting everybody's viewpoint to be able to really understand how to be able to encompass an entirety of a solution. So what do you, as far as kind of final words for the autistic people, families, educators, researchers, providers listening to this episode, what do you want to leave them with as far as a next step, or even a challenge to say, hey, you know what, you've just listened to the value of being able to have these groups that are coming together to talk about it, pushing research, pushing practice, pushing improvements. But what would you be telling them to do to take away from the discussions that we've had today?
Oh gosh. I think, again, there are some challenging times, but I would encourage people to remain hopeful. I think at the same time we're seeing challenges, we're seeing some historic investments in autism research and supports and services happening. And I think there are breakthroughs coming because we're beginning to approach research differently. We've we've recognized that lots of groups have been left out, including those who with profound autism,
Hmm.
families of color, families in poverty. And I think I would encourage people to remain hopeful in this moment because I think we have recognized that lots of people have been excluded and they deserve to participate in and benefit from the work from this work as well. And I think more researchers are recognizing that and trying to do a better job of reaching those communities. So remain hopeful in this moment, I guess would be my message.
Yeah, and I think that's a great message for everybody, not just researchers, not just practitioners. It's, how can we be involved to make something better?
Yeah.
Instead of sitting on, something's not working, it's how do we bring that community together? How do we get the right people in the room at the right time to start trying to find steps forward so that we can all feel improvement in our lives? But I appreciate you coming on and discussing where can people hear about Beam or learn more about what you all are doing or get involved if they're a researcher out there and want to be a part of that group.
Well, I'm a terrible social media person, but you can connect with me on LinkedIn, and I'd be happy to connect people with Beam and help you learn more about it. I'm at UNC Chapel Hill, so it's always easy to Google and find me and shoot me an email. One of those very responsive email people. So
Well, we appreciate your time once again, Brian, and I look forward to seeing all the wonderful research that's being put out by all those participants that are part of your network. So thank you again for joining us.
thank you for having me today. It was great being here.
Thank you for listening to Autism Weekly. We hope you tune back in next week to learn more about autism in the real world. Autism Weekly is now found on all the major listening apps, including Apple Podcasts, Stitcher, Spotify, Amazon Music, and more. Subscribe to be notified when we post a new podcast. Autism Weekly is produced by ABS Kids. ABS Kids is proud to provide diagnostic assessments and ABA therapy to children with developmental delays like autism spectrum disorder. You can learn more about ABS Kids and the Autism Weekly podcast by visiting abskids.com. Thanks for tuning in. See you again next week.